Well, welcome back, everyone. You know, when it comes to your health, early detection can be life-saving, especially with breast cancer. But with many types of screening out there, what is the best option? Well, today, we're joined by Dr. Darlene Weyer from Lima Memorial's Health System's Women's Health Center to bring some clarity to this topic. So thanks so much for joining us.
Thank you for having me, Chris.
My pleasure. Well, firstly, besides an annual mammogram, what other types of imaging modalities are out there to actually detect breast cancer?
So there are several imaging modalities out there to detect breast cancer, but I want to start by saying that screening mammography, mammograms, are the gold standard. It is the best way at detecting breast cancer as a screening modality. The sensitivity is anywhere from 80 to 95%. It's much greater and much higher for detection of breast cancer as a screening modality. So it is the gold standard. But there are other imaging modalities that are currently available that we can use in conjunction with the mammogram to give us additional information to zone in on areas of concern. One of those is ABUS, which is an automated breast ultrasound. We can even do handheld ultrasound for targeted areas once we find something on the mammogram. Breast MRI is a great modality. And there's something also called thermography that can be used as a screening modality.
Very interesting. So can you actually tell us a little bit more about thermography?
Yes, thermography is different than mammography or ultrasound in that thermography uses differences in temperature to detect areas of concern within the body. And it can be used for the breast to detect increased temperature within the breast. The thought process is that with cancer or any type of inflammatory disease process, there's increased blood flow, so therefore increased temperature. Whereas mammography and ultrasound is more it's structural. We're looking for structural changes, which is much more sensitive. Thermography is about 47% sensitive for detecting breast cancer in comparison to mammography, which is can be as great as 95%.
Okay, so I think you just answered my next question, but I'm going to ask it anyway. I was going to ask you, why is mammography still recommended over other screening options like thermography, but it's better detection, right?
Absolutely, it's better detection. There's just a minimal amount of radiation from the mammogram. We get more radiation by walking around outside or flying in an airplane, being on our phones all day. That gives us a lot of radiation. So the amount of radiation with a screening mammogram is very low. And it is the best way to detect breast cancer as a screening modality.
Okay, so if someone gets another screening, like let's say a thermogram, and it comes back abnormal, well, what exactly should they do?
The first step they should do is to consult their physician and then to have a mammogram to follow so that we can correlate that area of abnormal temperature within the breast tissue to see on the mammogram if we see any structural changes, and if so, then we can move forward at detecting that area and to see if it's a breast cancer or not.
Okay, and if someone wants to schedule a mammogram, you know, you could do that at Women's Health Center or at LMHS, Wapakoneta Medical Center, and the number is 419-998-4497, and then you just choose option 1. So, Doctor, I really appreciate you coming out today and also clarifying so much for everyone.
Thank you, Chris, and thank you for having me.
My pleasure. Well, don't go away because we have more when we return.